So if you're someone who suffers with low back pain, you may be wondering, well, what type of low back pain do I have? And if you're not sure, then this video is for you. Hey everyone, it's Dr. Heather here, and I want to go through 5 different types of causes for low back pain. So we're going to kind of break things down. We're going to look at like the top 5 that can be creating your low back pain. Now, as always, if you have specific questions, drop some comments down below. And if you haven't clicked the subscribe button, go ahead and do so today. Now, like I said, we're going to take a look at 5 different types of low back pain, those specific conditions, and then what we're going to do is we're going to go through the general symptoms that you can experience and kind of what that treatment protocol will look like. Now, this is a general overview just meant to really kind of educate you guys, so this way if you're experiencing low back pain but not sure exactly what type of back pain you are having, this may answer those questions for you. Now, the first one we are actually going to take a look at is a disc injury. Now, a lot of us may actually assume the minute we get low back pain that we now have a disc herniation. And you might be saying, oh my God, I'm going to need surgery. Not really necessary. So a lot of times we can have multiple disc injuries in our body, but it's whether or not they are becoming problematic. What do I mean by that? Well, the answer is simple. So what we want to look at is that disc herniation now going ahead and creating neurologic symptoms like pain, radiation of pain, numbness, tingling, maybe you're losing some muscle weakness. So now what we want to do is take a look at that degree of severity when it comes to a disc herniation. Now in another video, I'm going to kind of go over the different types of disc herniation that you could be experiencing because there are 3 different levels depending on how the nucleus pulposa, how that protrudes out through the outer layers of the fibers of the disc. Now, as you can see from the diagram that I've kind of put here, this is kind of now showing you the 3 different levels of disc injury depending on the severity of the injury. And again, like I said, you could have that disc herniation and it may not require surgery because again, it depends on how much of the actual disc is protruding through those outer layers and how much pain and discomfort you are suffering with. Now, the next condition that we want to look at, which is actually kind of common, is known as facet syndrome. And you might be wondering, well, what is that? Well, I'm actually somebody who has facet syndrome, and I haven't had surgery. But at a young age, I partaked in gymnastics where you're doing a lot of extension movement patterns. And at a young age, your body can actually bend and is very mobile. So, of course, I increased my lordotic curvature to my lumbar spine, allowing for those facets to override themselves. And what happens is you notice a lot of aching, kind of discomfort, low back stiffness, more generalized in that area. Usually there is no radiating pain with facet syndrome, and just some good core exercises can help there. Now, the next one we want to look at is what's called spondylolisthesis. Now, you may be saying that's a tongue twister of a word. Well, yeah, it is. But what it actually means is slippage of a vertebrae. And you might be thinking, ooh, slippage? How can my vertebrae slip? Well, it's kind of simple, but a lot of times this one kind of just goes undiagnosed because we aren't aware that we have a slippage. Now, you could have an anterior spondylolisthesis or a posterior spondylolisthesis. It all depends on how it slips in its actual little space. Now, again, when we go into more detail in another video on spondylolisthesis, you're going to see there are different degrees of spondylolisthesis, and that's how we actually determine its treatment protocol. Because a lot of times a spondylolisthesis can be well taken care of with some maintenance and preventative measures around really just understanding what needs to happen to our body and how we would utilize some core stabilization, core stabilizing work to really kind of help that spondylolisthesis. Now, the next one we do want to talk about is actually sacroiliitis. Now, this is something I did talk about in another video as well. And so if you want more information on sacroiliitis, do take a look at that video as well. But sacroiliitis is essentially just inflammation of our SI joints. That's where our sacrum and our ilium meet. And what happens is we notice some very localized discomfort, maybe going down into the buttocks region, but we're noticing a lot of inflammation there, and maybe we're also having a little bit of radiating pain, but but probably not a ton. Now, all of that can be, really done with some myofascial work, using some different types of forms of PT, and again, some core stability work. Now, the last one we do want to talk about is just your classic sprain strain, which means chances are you kind of just overused your body on the weekend doing some yard work, maybe you started lifting heavy, or maybe you were moving some stuff out of the house and all of a sudden you notice just a lot more localized low back pain. Now, again, here with something just as simple as a sprain strain, that's when we start to look, well, is it a little bit more of an overuse injury, and how can we go ahead and really prevent that from happening again? Well, that's when we want to use our myofascial techniques. We want to use that ice, and then maybe we want to use it over-the-counter anti-inflammatory to help with that condition. Now, like I mentioned, these are just kind of 5 different types of low back pain that you could be experiencing. But if you really truly want to know whether or not you are experiencing one of these specific types, then book that consult with me and we can go through that a little further. These 5 types of low back pain can be eliminated with just understanding some basic principles on myofascial work and core stability work. For more information on core stability, check out my 5 core stabilization exercise video, which will go into a little bit more in-depth detail regarding how you would start to do some core work. Now, as always, if you have further questions and aren't sure exactly what you should be doing for you, drop some comments down below. I'm happy to go ahead and speak to you on an individual basis. Now, if you found this little overview helpful, give it a like, and I'll catch you in the next video.